Well, tonight, a major development in the battle against COVID. Pfizer proposing a third dose of its vaccine. It would be given 6 months after the second dose.
Their study found it gives you 5 to 10 times more protection against the Delta variant. But the CDC says people who are fully vaccinated are protected. Right now, almost 56% of eligible Americans are fully vaccinated. That's Americans who are 12 years and older. And just over 64% have received at least one dose of either Pfizer or Moderna. News 6's Troy Campbell is live at Advent Health tonight, where those cases are going up. Troy.
Yeah, here at Advent Health, a doctor in the ICU says almost all of the COVID-19 patients that are admitted have never received a COVID-19 vaccine. And as the Delta variant continues to spread, Pfizer now says they plan to develop more shots to help stop the spread of the virus.
Delta is the dominant strain now.
Dr. Stephen R. Smith with Advent Health saying there are thousands of Delta variant cases in Central Florida. He says while the overwhelming number of people contracting COVID-19 are unvaccinated, there are still cases of vaccinated individuals contracting a variant.
The efficacy, the effectiveness of the vaccine drops against the variant. So yes, that means there's a fraction of people who are vaccinated who are getting COVID as a breakthrough case.
In an effort to combat the Delta variant, Pfizer announcing its plans to create a new vaccine specifically using the genetic makeup of the Delta variant. The pharmaceutical company also saying current trials of a third dose or booster shot to its 2-dose vaccine show it significantly increases the amount of proteins used to fight COVID-19 and its variants. Pfizer says it plans to submit the data to the FDA, and a Delta variant vaccine trial could begin in August. In response, the CDC tweeting Thursday night, Americans who have been fully vaccinated do not need a booster shot at this time. We are prepared for booster doses if and when the science demonstrates that they are needed. The CDC saying, with the spread of variants, vaccinated individuals who are symptomatic can still spread the virus.
Typical of upper respiratory symptoms that people may just ignore and as not as being COVID-19. So what I would say is if you have those upper respiratory symptoms and you've been vaccinated, you should absolutely get a COVID-19 test.
The CDC director also said that 99.5% of all people with COVID-19 who are dying have never received a vaccine. Advent Health says that they submitted to a lab 1,000 positive COVID-19 tests, and they say about half of those came back testing positive for a variant. Live outside Advent Health tonight, Troy Campbell, getting results, News 6.
Troy, thank you.